Yeah, so you had mentioned research. So research is something
Yeah.
that I'm not sure that most clients really realize is part of maybe any medical field. Like sometimes when I talk to owners, they're not even aware of how much research happens with human as well. But we
Mhm.
obviously research plays a huge role in veterinary medicine. And like from a high level, it's how we know what works, right? So tell us about, your role in that.
Yeah, so research is something that number one is it's always been one of my biggest passions in veterinary medicine. It's what we've done or what I've done through vet school, through residency, and through fellowship, and now in clinical practice. But research is always a little scary conversation on the basis of people really don't want to think that their pet is going to be a mouse or a guinea pig, I guess, for some kind of new untested project. And that's really not what we're doing. I would say the biggest thing that we're doing for clinical research in veterinary medicine is that we want to not just provide the gold standard care for your pet, but we want to provide the gold standard care and see how we can improve that care. And so how we generally perform clinical research, or the way that we integrate clinical research into a specialty practice, is that once something has been proven to be safe and effective, then we take those techniques, we take those medications, we take those procedures that, again, we know is safe, we know it's been done on a variety of pets. We want to see if it actually makes a difference for our pets. And so, for instance, one of the new clinical research trials that we're going to be opening up at North County, or at San Diego in our North County practice, is again performing a minimally invasive lung surgery for patients with cancer, to prove that we can actually have a major clinical benefit for those patients from a pain standpoint. Meaning that, yes, we can do these procedures open or in a conventional way, but we want to really define this is how big of a benefit you get for those patients from doing it from a minimally invasive option. So one of the first trials that we're going to be opening up, it's called the MIMIC trial, in which we're doing a minimally invasive metastasectomy. So for patients that have developed a pulmonary nodule from a different cancer, traditionally, again, you have to spread the ribs to go in and try and remove that tumor. We're going to do all of that through a couple pinpoint holes into the chest cavity to be able to get the same outcome for those pets in a proven manner, but then really clarify and define exactly what that benefit is for the pet. So it's a really exciting way to improve care for all of our pets, prove exactly what these techniques can do for those pets, and again, provide gold standard care that often you can only find in specialty human healthcare, but actually for our veterinary patients.
That's actually what I was going to bring up. A point is that, one of the fascinating things, or the things that I love, is sort of the spillover between human medicine research and veterinary medicine research, because often, we will take what maybe has worked in human medicine and see if we can extrapolate that, if it can work in veterinary medicine. But the same is true vice versa. I mean, sometimes these human medicine doctors and
Yeah.
researchers are looking at what's going on in veterinary medicine and whether or not they can sort of utilize that to benefit our, the humans. So I find that also
Yeah.
fascinating. Do you see a lot of that with the surgery in particular?
Yeah, I would say for surgery, in particular for oncology or cancer care, I think that research is it's such a valuable space in veterinary medicine, because it's a lot of these therapies, a lot of these procedures are incredibly expensive, and so if we can actually get this gold standard therapy through a clinical trial, we can often have whatever the clinical trial is pay for that care for the patient. So instead of having the client to spend thousands of dollars for, again, this minimally invasive surgery, if we can do that through a clinical research project, we can get a vast majority of those costs taken care of through the clinical trial. And so, again, we can provide gold standard level care that otherwise would often be too expensive or unreachable, unattainable for a lot of these clients. And then the biggest benefit, I think, is that dogs and cats get the exact same cancers as humans do. So, for instance, a lung tumor in a dog is so genetically similar to what we see in humans. The proteins are very similar. The genes are very similar. The response to treatment is very similar. And so the biggest difference is really the timeline, meaning that for our dog patients, we know that if we can get them to live to 12 years old, 14 years old, that's phenomenal. And we can study the progression of disease in a period of 1 to 2 years, which on the human side would take 5 to 10 years. And so we can actually very quickly accelerate the discovery of how the drugs interact with a particular tumor, and how, again, a therapy can actually be effective for a patient. And our actual dogs, that, again, we're providing that gold standard. We're finding that disease response to treatments that then can go on to actually improve the lives of humans with a similar disorder. And it's really exciting because, again, it's something that would often be unattainable. And just as a reference, or one of the greatest ways that I've seen this play out is during my residency, I actually did research on brain cancer. So dogs get, particularly Bulldogs and brachycephalic dogs, they get very similar brain tumors that humans get. And it can be a very, very devastating disease, both for dogs and for humans. And it's a challenge to be able to treat dogs because, again, the standard of care, the gold standard, is going to be brain surgery followed by some form of chemotherapy. And a lot of clients can't afford brain surgery because that's obviously a very expensive thing to undertake. And so through the clinical trials that we had fully funded, we were able to do these brain surgery procedures for the patients. We were able to integrate chemotherapy after. We were able to integrate immunotherapy. So again, using the body's own immune system to try and fight off the tumor. And this is a gold standard care for a human with a brain tumor. We're able to do that in your dog. And again, assess to see, for something that we already know is safe, we can assess to see how effective that is for improving the outcome for those patients. And then once we have that data and information, we actually saw what we were doing for these dogs with brain cancer translate into human clinical trials as well. So
awesome.
It was so exciting to see something that we had worked on for 3 to 5 years, had very good success with dogs, then go on to be performed in humans, because we saw that it was very effective in our dog patients. And so they saw that benefit and then translated it to human healthcare to actually improve the care of cancer for patients with brain tumors.
It's so cool. I love that.